This country's total COVID-19 related deaths have passed the 2,000 mark, with 11 deaths recorded over the last 24 hours. The death toll now stands at 2,009. Among the fatalities are 8 men and 3 women. 7 people had multiple comorbidities, including diabetes, hypertension, and heart disease. 2 had only one comorbidity, while 2 others had no known comorbidity. There are also 689 new cases of COVID-19. Active cases now stand at 9,297. 542 people remain at hospital and are being treated for COVID-19, while 64 people have been discharged.
And Minister of Health Terence Deyalsingh is dismissing claims that a shortage of intensive care level nurses in the ICU is to blame for the recent COVID-19 deaths. The line minister said his ministry has implemented electronic monitoring of patients at the Couva Hospital and multi-training facility, with plans to install the system in several other hospitals. He said the electronic systems located in the cold zone areas of the hospitals monitor patients' pulse rate and cardiac rhythms. He added that the ministry is also implementing other strategies to maintain optimum level of care at the hospitals.
We have trained since last year about 200 nurses in ICU management. We brought in about, I give the figures, 18 and 7, about 25 ICU nurses from Cuba. And the fresher ICU nurses who have been trained and are doing their practicals, they are always paired with a more experienced person.
CEO of the North Central Regional Health Authority, Davelyn Thomas, is denying that the mortuary is overwhelmed with people who died due to COVID-19. His statement came following an article in a daily newspaper, which claimed that the mortuary was under pressure and that there were bodies on top of bodies. Mr. Thomas said while the claim in the newspaper was not true, such a statement could be reached if the majority of the population do not get vaccinated.
The IRT, which is our incident response team. We have 3 tiers of effort, of escalation, and they are gray, blue, and red. We're at blue. So we're not at that red zone as yet. But if people don't get vaccinated, I could imagine the possibility.
Mr. Thomas, meanwhile, added that NRCHA outsources funeral homes for COVID-19 related matters to ensure the authority does not operate beyond capacity.
Our mortuaries, we basically outsource. So the idea of being overwhelmed at the facility really doesn't apply. You know, we have a listing of approved suppliers or funeral homes that we utilize if we have an increase in bodies to care for, to engage.
The NCRHA also denied that patients were being turned away due to a lack of resources and stated that patients are triaged but critical needs are attended to with utmost priority.